Hello, everyone, and thank you for joining us for this webinar, Building Confidence in the COVID-19 Vaccine During Pregnancy. This webinar is being co-hosted by the American Hospital Association and the American College of Obstetricians and Gynecologists. I am your moderator, Robin Begley, Senior Vice President and Chief Nursing Officer at the American Hospital Association, and the OB area was my clinical area of expertise early in my career. So it is really a delight to be here with you today. This webinar is part of AHA's Joining Hands for Greater Impact series, which highlights how hospitals and health systems have partnered with their communities to respond to the pandemic. We would also like to note that this event was funded in part by a cooperative agreement with the Centers for Disease Control and Prevention. The contents of this resource do not necessarily represent the policy of CDC or HHS and should not be considered an endorsement by the federal government. Today's webinar comes at a particularly important time. The COVID-19 vaccines have been available for over a year, and the current Omicron surge is putting more pressure than ever on our hospitals and the providers that work there. While we know that receiving a COVID-19 vaccine is a critical step to foster a healthy pregnancy, some people continue to have questions and concerns about the effects of the vaccine on their pregnancy. During today's conversation, we will speak with experts from the CDC and healthcare leaders from across the country who will share their insights into how to convey the importance of vaccination for pregnant people to their patients and community members. We'll save the last few minutes of the webinar for questions. As your questions arise, please enter them in the Q&A box as we respond to as many questions as we can. Now, I'm really pleased to introduce you to our speakers. We will start with a discussion with two leaders from the CDC, Dr. Dana Meany-Delham, Chief of the Infant Outcome Monitoring Research and Prevention Branch at the CDC, and Kara Pullen, lead for the Health Communications and Research Translation Team in Infant Outcomes Monitoring, Research and Prevention Branch at the CDC. What a mouthful. We will then turn to a panel of hospital leaders to share their experiences and perspectives, and I'll hold and wait to introduce them to the second part. We will all come together near the end for a group discussion and to answer your question. Let's jump right in with Dana and Kara. Welcome, Dana and Kara. Can you each introduce yourselves and tell a little bit about your role at the CDC and an overview of what you've been doing to build confidence in the COVID-19 vaccine?
Absolutely. First, let me say thank you to the American Hospital Association and to all of our partners for hosting this important meeting. We really appreciate your partnership. We appreciate you bringing attention to this important matter. So thank you. And thanks to all on the call who have joined to speak with us and to join and partner with us on this important issue. So I have, since 2020, been heavily involved in the COVID response. I think we're all involved in the COVID response. This pandemic has drastically affected us all. My role has been both to help understand the impact of COVID-19 on pregnant women and infants, but most importantly, my role has been to help lead efforts to promote maternal immunization for this population, to make sure pregnant women, infants, women trying to get pregnant, women who were recently pregnant are considered. And we've been working tirelessly to collect data both on the disease, COVID during pregnancy, in partnership with our jurisdictions, but also on the safety and effectiveness of vaccines. Many of you may know that when the vaccines were initially rolled out, we didn't have much information about these vaccines during pregnancy. Recognizing this, CDC rapidly established systems and leveraged existing systems to collect information about the safety and effectiveness of these vaccines. And all of the evidence to date has been the foundation for our vaccine policy, where CDC, along with many other clinical partners, have strongly recommended vaccination for pregnant women, women considering pregnancy, women after pregnancy, to protect both them and their pregnancy. So we've been doing a lot to build confidence in COVID-19 vaccine. We've tried our very best to provide the scientific rationale for why persons who are pregnant, considering pregnancy, or recently pregnant should be vaccinated. We've done our very best to communicate as rapidly as we can that vaccines are safe and effective for mothers and babies, and COVID is not safe for mothers, infants, or pregnancies. So that's in a nutshell. I do want to say that Kara Pullen has been our lead communicator, and I'll let her introduce herself now.
Sure. Kara?
Thanks, Dana. Thanks, Robin. I want to echo Dana as well and just share my appreciation for you guys hosting this webinar today. We're really pleased to be here and share what we know. So my name is Kara Pullen. I'm the lead for health communications and research translation in our division of birth defects and infant disorders. And for the last 2 years, I've served on the COVID-19 response, primarily in the role of communication and messaging around COVID-19 vaccination during pregnancy. So I've been sharing messaging to improve uptake overall before and during pregnancy, but also thinking strategically about how we might reach those who are most at risk for severe illness and pregnancy complications related to COVID-19 infection during pregnancy, and sharing all those messages that Dana just shared about the safety and effectiveness and what we've learned over the last year.
Thanks, Kara. So turning to Dana, what are you seeing? You mentioned data a little bit, in your intro, and what are we seeing in the data related to vaccine uptake during pregnancy? Where are there disparities? And what do you see in the data that perhaps gives you some hope?
So thank you so much. So first, let me say that all of the data that we have about vaccination during pregnancy is compiled from either survey data or from some of our systems, like our vaccine safety data link system, which is a conglomeration of academic centers that evaluate vaccine uptake and vaccine safety. So we don't have a national estimates. We have to make some inferences from these two data sources. So I just want to acknowledge that up front. Regardless, no matter what data system we're looking at, pregnant women are not vaccinated at the same rates as non-pregnant persons. So that persists. And it's not unexpected, given that we didn't have data initially when these vaccines rolled out. However, we now have lots of data that prove the safety and effectiveness of these vaccines. The other thing that's been a huge challenge is that there was a lot of misinformation that was put out by various groups about vaccine, really without any evidence base, to really scare people into not receiving the vaccine. And so that's saddened me as an OBGYN, because it means that we have many pregnant women who didn't get vaccinated and then ultimately are in the ICU in the hospital because they've gotten very sick with COVID. What we have known for months now is that COVID is more severe in pregnancy. Women are more likely to go to the ICU. Pregnant women are more likely to die. Their pregnancies are complicated. They can go into preterm labor. They can wind up with babies born early. And there's an increased risk of stillbirth. We've known that for a very long time. And now we have the data to show that the vaccines are safe and effective. So I'm saddened that we still have these low vaccination rates. And part of what we're doing here today is to get the message out of the benefits of vaccination that far, far outweigh any potential risks.
Thank you, Dana. Communication is so important, and that is your role at the CDC. So how are you communicating about vaccine safety during pregnancy nationally? Any ideas or anything you can share with us about what messages are resonating? And we know the importance of tailoring messages to certain communities. Can you address that at all?
So first, I'm going to turn this to Kara in just a minute. But first, let me say that we have a pregnancy page on our COVID data tracker. So all the information about pregnancy, whether it be about the disease or about vaccine rates, are all housed in one pregnancy page on our website. And people are actively working with our jurisdictions, working with our academic partners to keep that data updated. So that's out there. We've continuously updated that information as we've learned more and more. As each study comes out, Kara tirelessly summarizes it and puts it up on the website so that really it is an up-to-date resource. We also work with many partners, including obviously the American College of Obstetricians and Gynecologists, Society for Maternal Fetal Medicine, AHA, the Infectious Disease Society of America, the American Academy of Pediatrics. So we're all talking on a regular basis, especially when new data comes out. On our website, you will see that we still have major health disparities. We know that vaccine coverage rates are lowest among non-Hispanic Black women. And that's concerning because we also know that COVID disease is more severe and has a predilection in that population. So the trends are not positive in that way when you look at the differences by race and ethnicity. The positive spin is that we are seeing increasing rates of vaccination coverage for pregnant women. And I think it started to increase around Delta and even a little bit more with Omicron. Still not where it needs to be, but we are starting to see some trends. And I think that's because of the universal message from clinical partners, from CDC, from various groups, all promoting that the benefits of vaccination outweigh the risks. I can say we have many different messages as a practicing OBGYN. I speak to my patients at every prenatal care visit. I ask them what their concerns are. I ask them, why they're reticent, why they don't want to be vaccinated. And for some women, I can dispel the myths or the misinformation. For others, they want to confer with their family, their community members, who may not encourage them to be vaccinated, which is why it's important that we have a whole of community approach for these conversations. And again, speaks to why we're here today. But Kara, I want to turn to you and see if you have more to add.
Sure. So I can say communicating about vaccine safety during pregnancy, especially related to COVID-19, is challenging. And it has been particularly challenging for this response because we didn't have the data at the beginning. And it's been something that we've had to sort of evolve over time. But over the last year, we have seen the evidence base really grow. And there is a lot of information out there now about what we know about the safety and effectiveness of these vaccines. And I think for CDC particularly, we've been sharing information on social media, really highlighting new findings that can give people confidence in these vaccines with media releases, and really doing what we can to share what we know about the safety and effectiveness of these vaccines before and during pregnancy. We have a lot of resources, as Dana mentioned, on the CDC website, so both for general consumers about video PSAs featuring OBGYNs in English and Spanish, sort of answering and addressing concerns that people have about pregnancy and fertility related to COVID-19 vaccination. But we also have resources for providers. So how to have those conversations, tips on motivational interviewing, those kinds of things, even handouts and fact sheets that can really help support those conversations that patients can have with their providers. As Dana mentioned, we know that conversations with providers are really important for this population, but we also know that there are other trusted sources in the lives of pregnant women, mothers, grandmothers, sisters, friends, partners. There's a lot of people who have an influence. As a recent mother, a new mom during the pandemic, there are a lot of people tell you what they think when you're pregnant. And so really trying to share these messages broadly so that everybody who is having conversations with someone during pregnancy is really sharing the same message, and that consistency in messaging is really important, I think. So we've been partnering with organizations like ACOG, like the Society for Maternal Fetal Medicine, to make sure that providers are aware of the recommendation and are all sort of sharing the same recommendation, and that they have the resources to have conversations with patients. But we're also working with other partners who might reach some of these other populations that are providing information to these trusted sources and the lives of pregnant people.
Yeah, that's great, Kara. Really true and, insightful thought that the family members, particularly the moms of our pregnant women, are, very influential in giving advice to their family members. So
yeah, and just to chime in too, you mentioned what messages are resonating with pregnant people. I think that's something we're still, trying to figure out the best approach. At CDC, we really are driven by the science and we like to lead with the data. So we've been trying to link what we've been seeing in the data. During the Delta surge, we saw a lot of increased death among pregnant women compared to the entire response. And so tying that to, if you want to protect yourselves, this is the best way to do it, is to get vaccinated. And a healthy mom is important for a healthy baby. But we also know that while CDC likes data, sometimes one good story can really change people's minds. So we've been working on a project with our partners to get testimonials from pregnant people, sharing their why and sort of how they came around to the decision to be vaccinated despite their hesitancies. We have some interviews going on pretty soon to hopefully better understand some of the hesitancies and the rationale of what would motivate them, how might we creatively tap into those things that might make the most difference to them in our communication.
Yeah, thank you for that. Dana, you referenced before, and we know that you're practicing OBGYN. Any one or two particular, themes that you're hearing from your patients about the vaccines that you'd like to share with all of us?
So I think the two biggest concerns that I have heard are, one, this went too fast, and how do we know they're safe? And so providing the information that's available on our website about, hundreds of thousands of women that have been vaccinated during pregnancy, prior to pregnancy, after pregnancy, sharing the data about that's come out just recently showing no link to infertility with these vaccines, either in men or women. So sharing that information and the experience with them, with folks who are concerned about how fast this whole process went. I think people translate the fast process with it not being rigorous, and that's not true. It was a very, very rigorous process, and we have lots and lots of experience because of the uptake of vaccines that has occurred to date, which, for other vaccines may have taken years to actually pull together. So that's one big piece. The other piece is sometimes when I'm speaking to patients, they don't know why they are reticent to get the vaccine. When I sort of push and say, what are your concerns? And they can't necessarily articulate their concerns. So that's why it's important that these conversations take place at multiple visits. And during prenatal care, I might have my initial conversation with them and they say, well, I don't know why I don't want to get it. And so I said, okay, well, why don't you think about it? Let me give you some information. And then when you come back for your next visit, let's talk about, what you're thinking. So I do think that continuous conversation is important, especially for those who are, perhaps in their first pregnancy where everything might be somewhat overwhelming. For women who've had babies before and maybe have received Tdap or the flu vaccine, the conversation goes a little bit easier, although there is still there is still some reticence that may happen with COVID vaccines, even if they accept flu or Tdap.
Mm-hmm. Thank you. And Kara, any final words about communication that you'd like to share with our audience?
Sure. I just think doing what we can do to make sure there's a consistency in messaging from all the people in the lives of pregnant people, I think is very important. As Dana mentioned early on, there's been a lot of misinformation in this space. And so trying to come to the table with accurate information, really trying to address people's concerns, but also giving them the space to ask questions and have that open dialogue. And if we can have, people feel more confident when they're getting the same information from multiple people and that there's data behind it to support it. And I know, it is challenging and it is something that we continue to have to chip away at, but we can work not just with clinical partners, not just with physicians, but also nurses, midwives, other people who are having those conversations, not just in healthcare, but also in the community. We're working with March of Dimes, we're working with local community-based organizations, really trying to get the message out so that we're all strongly recommending it. We're all sharing the data accurately and appropriately so that we can emphasize it's a community effort. It's going to take all of us to really improve vaccination rates in this population.
Thank you both. Really informational. And I know you're going to be around after the second panel for Q&A. So to everyone in the audience, if you have any specific questions for Kara or Dana, we will try. We'll try very hard to get everybody's questions answered. Thanks again. So next, I'd like to shift gears a little bit, and we'll start with some introductions. And I'm just going to give you the formal introduction, and then we'll hand it off to our our panelists. So we have Dr. Sharmila Makija, who is Chair of Obstetrics and Gynecology and Women's Health at Montefiore Medical Center. Dr. Ashonda St John, Chair of the Department of Obstetrics and Gynecology at Health Alliance of the Hudson Valley. And also Courtney Latimer, who's Program Manager of the Women Inspired Neighborhood Network at Henry Ford Hospital System. So welcome. And let's start with a little bit of a further intro. Can each of you tell us about yourself, your organization, your role there, and a little bit about the patient population you serve? Ashonda, can we start with you?
Absolutely. Thank you for this opportunity to participate in such an important discussion. So I am Ashonda St John. I'm the Chair of Obstetrics and Gynecology at Health Alliance, which is located in Kingston, New York, which is upstate New York. After working over 17 years in New York City with the effects of COVID, I've traveled upstate, and now I serve more of a rural community and population, which is diverse in its racial and cultural and ethnic diversity and demographics, but also it is very different from an urban setting. So I am here, I am working with providers within the community, which include midwives and doulas, and also family medicine providers. And we are, as a unit, trying to help combat this COVID pandemic, but also encouraging our pregnant people to be vaccinated. So thank you for this opportunity.
Thank you. Sharmila, next.
Yes, thank you. It's such a pleasure to join you all today on this very important topic and concern, for all of our patients. I'm Sharmila Makija. I'm professor and department chair of OBGYN and Women's Health at Albert Einstein College of Medicine, Montefiore Health System in the Bronx in New York. We have a very diverse and vibrant population of patients we serve from many ethnic backgrounds, over 15 language and cultural needs that have to be met. And so as a result, we have a very diverse group of providers, and our department consists of over 100 doctors and 9 specialties. We're the third largest residency training program in the country. And so we provide training for close to 300 trainees a year. That includes med students, residents, and fellows. So thank you for allowing us to join in today to really help address this topic.
Thank you. And Courtney.
Hi, everybody. My name is Courtney Latimer. I am program manager for the Women Inspired Neighborhood Network at Henry Ford Health System in Detroit, Michigan. And I also manage our community health worker hub. And with the WIN Network, we utilize community health workers to address social determinants of health as co-facilitators of group prenatal care along with medical providers. And I also work directly with community health workers and departments throughout the system to properly recruit, train, and deploy CHWs. We have community health workers in several different departments, including, but not limited to, diabetes care, comprehensive care, our brand new Henry Ford Cancer Institute, the WIN Network, which is, again, our women's health and infant mortality department, and then a host of other grant-funded projects that we partner with other organizations with.
Welcome. So we'll start with some questions. What have you been hearing and seeing from your patients regarding the vaccine? I guess I'll direct that to Sharmila and Ashonda first. Are there any particular themes or issues that stand out among those that are hesitant to receive the vaccine?
I think of what Dana had said before in the previous segment is that, this is a conversation that needs to be had continuously throughout the pregnancy, but also in patients who are thinking about conceiving and also in the postpartum state. I think the recurring theme that I hear is fear. They don't believe, like Dana had said before, that the vaccine happened very quickly. They don't really kind of understand the science that went behind the vaccine happening, but also their concern is the effect of the pregnancy. And then also we have to really grapple with the misinformation that is out there that has also tainted their decision to be vaccinated. And so I think that it's a very slippery slope to navigate through these myths and misinformation that our patients have, but also respectfully listen to what they're saying, and also making sure that they're thoughts, opinions are validated and that we are understanding their lived experience and respecting that, but also educating them. And these are kind of things, the themes that I hear as a practicing OBGYN.
Yes, I'll echo what Ashonda said and what Dana and Kara have said earlier. Our experience in the department is that we really are seeing two subsets of patients that seem to be hesitant about the vaccination. And we've got one group that are patients that just need information. They're willing to listen. They may just need a visit or two to get to the point where they can accept the vaccine. And for us, language barriers are a real issue. And so, but this is the work that we're used to doing. And the challenge for us, like everyone else, is time and attention. But it is feasible. So that's where we're willing to spend the time doing it. And so the key for this particular group of patients is educating and having enough time, which are essential for success. And again, we are slowing down to do it even, or trying to at least do it more respectfully and culturally sensitive. And then there's the other group of patients that seem to be getting their information from family members or perhaps even the media that's often confusing and at times just frankly incorrect. And this results in a mistrust, we feel, that's towards the vaccine and even with the providers that are trying to administer the vaccine. So with those patients, it's very hard to make any progress at all. And some of these patients we've seen have actually received their original vaccine doses, but they don't want to get the booster despite the counseling. So this particular group is very challenging, and why we're here today to really address different avenues of how we get vaccination rates higher.
Yeah. So, interesting that you mentioned trust, Sharmila, or distrust. It's so, we all know, as, whether you're a healthcare provider or, you work as a caregiver in the healthcare space. I mean, trust is so foundational and important. So how are, maybe you could describe some touch points that you can use to build trust with your patients throughout their pregnancies, or perhaps, as you mentioned, prior or after.
Yes, it's, we approach this conversation as really a learning opportunity and try to diminish any defensiveness. If we can start where we're just open to listening, and go slow and methodically with what the patient really is asking. And we need that from both sides, frankly. Even our providers that are frustrated with having to convince patients to learn why our patients are not trusting the information. It's a different feel right now. And so we try to keep the lines of communication open. Our frustrations are really rooted in the fact that we see what happens to our pregnant patients when they're not vaccinated. And when we discuss the importance of COVID-19 vaccination in pregnancy, we share with our patients, as has been said before, the data about COVID in pregnancy. So we try to at least show the data that specifically COVID is more severe for our pregnant patients with a higher risk for complications, and that risk also includes increased pregnancy complications. So their baby is at a higher risk if mom does get sick. And we also talk about this is a way to protect their newborn. We talk about transplacental antibodies, which can help protect their newborn who can't be vaccinated immediately. So sometimes that often helps with their decision making. But we do come from a frame of reference of starting with respectful communication and taking the time to listen to their frustrations and concerns.
Thank you.
One thing I may add is also sharing with our patients our own experience. I find that is most helpful. And sometimes that's the one effort that turns the corner, that they know that you were vaccinated, that you got vaccinated while you were pregnant, or if you vaccinated your children. I find that is quite helpful when we kind of relate to our patients. And when I educate my other providers, I kind of go over this 4-step approach. And the first, most importantly, is listening to our patients. And again, there are always time restrictions and time concerns. But again, our patients need to be heard. And if we understand where this level of misinformation is coming from, then that way we can address it easier. I think also number two is sharing and being respectful of their lived experience. And if it is misinformation, educating them and having respectful communication. And then the fourth is hopefully vaccinating, because at the end, we want to conclude those with vaccinations. So again, that these pregnant people are safer and their children will be safer and that they will have better outcomes.
Yeah. Thank you for that. So we know that data is critically important as we continue to learn more about COVID-19. But as Dana mentioned earlier, sometimes it's the stories that really get to people and change their minds. Anything you'd like to share about, what story or anecdote that you could share that may resonate with the folks that are participating today, and they may be able to take that then back to their practice?
So I can add, not a very specific story, but what we have been doing in general, which is very different because we've always been very strict with protecting information about other patients. But we've started to share personal experiences as a frontline worker, as Ashonda just mentioned, as a way to make a connection. And obviously with, being HIPAA compliant, we are gently sharing with our reluctant patients the just brief stories of other patients that have been affected by COVID and that we've had to end up taking care of them that have needed hospitalization or respiratory support, all of whom have been unvaccinated. And so we're trying to make it more connected to what they're experiencing in real time, to show them the outcome. And we do feel that writing for the lay press in order to reach a wider audience is important, to share this unique frontline voices to the public. And that seems to be helping with the issue. And many of our doctors, including myself, have written some op-eds, and one of our physicians, Dr. Eve Krakowski, just recently wrote one last week for Slate. And we had an uptick in patients coming in wanting to meet her and talk to her about this very issue. So I think there's so many different ways to approach it, but I think sharing stories of other patients that are similar to what they're about to face has been really what we've found to be somewhat more impactful.
Thank you.
I think one other successful campaign ACOG put forth was having some of our pregnant providers actually get vaccinated and kind of providing their testimony. Because again, I think this builds up the trust and also the confidence and the understanding. And I think this makes our patients more ideal in getting vaccinated, especially during their pregnancy, knowing that there is the risk of severe disease.
Yeah, I'm familiar with that campaign, and I think it was very effective for sure. So, Courtney, thank you for being so patient here. How has the WIN network been engaging women in your community around vaccine confidence? Can you describe, some assets or existing programs that you've been able to leverage in this work?
For sure. So, WIN Network historically has a long history of community partnerships and trust within our community. I think the over 11 years of community involvement we've had has built that for us. And then likewise, Henry Ford Health System is a trusted partner in our community as a healthcare system, and we've poured that into our community with various programs and services. One example is Henry Ford was the medical partner for mass vaccinations. And so we deployed mobile units and created a plethora of collateral educational materials to help counteract the hesitancy across every segment of our community. And then also on our Henry Ford website, we have a community health section, and we revamped the layout. We feature education on how to stay safe, including the importance of social distancing, mask wearing, hand washing, as well as ensuring that all of this information that we provide is culturally competent and relevant, in addition to obviously being factual information. All along the way, WIN Network was also able to tailor our education to our own target population of African American women. With WIN Network specifically, when COVID and lockdown first began, we still had women in group prenatal care, so we were able to leverage our virtual platforms that we ironically had switched over to more reliable platforms prior to COVID being a thing. So we continue to work with those women and use our CHWs to be able to answer a lot of their concerns about COVID. Obviously, we can only tell them what we knew at the time, but as we got more information, we were able to partner with and discuss concerns about the patients with their providers to make sure we were giving out the accurate and up-to-date information as we could. We also utilize social media heavily. We ensure that we're always able to spread that information out beyond our active patients. And our social media engagement is pretty good. We have some pretty high activity on our social media, so we always utilize that platform and pass out information.
That's great. Do you have any formal partnerships that have been particularly helpful?
For sure. Yeah, besides the health system itself, in
Right.
partnership with Win Network, we reached out to our network, unintended. And when partners reached out to us, we always answered. We partner with, for example, the United Way of Southeastern Michigan, Black Mothers Breastfeeding Association, other hospitals within the Metro Detroit area. We've got really great partnerships, longstanding partnerships that we've already had. Sometimes we're asked to send a physician to speak on a webcast, or we're asked for PPP. And very often we're asked for things like information, factual information, things that we can provide. And so we've got so many partners, but definitely at the top list are our parent-led groups, our Detroit Parent Network. The Detroit Health Department for sure is our sister/brother department. And like I mentioned, the United Way of Southeastern Michigan all have been extremely helpful and beneficial during COVID.
So it sounds like you've reached out to really many community partners, and
Oh, yeah.
it's been very positive. So if you had one piece of advice, Courtney, for hospitals,
Mhm.
it sounds like you've got a great working relationship with Henry Ford and other hospitals. What would you say to hospital leaders that are working with community stakeholders to build confidence? What do you think is the key piece of advice that you would give?
I think a few things. One of the most important things for me is to communicate. Communication is extremely important. When you say you're going to be involved. And if you cannot be involved, it's okay to say no. It's okay to not stretch yourself so thin that you don't want to let your partners down. To have a good partner, you have to be a great partner. As our Nancy Combs would say, she was a very prized uh, team member of ours who recently retired, but she would always say, to have a great partner, you have to be a great partner. You show up for your partnerships. Lead by example, show up to meetings, be involved. Again, don't commit to something that you can't do. If you can't do it as a leader, then be intentional about designating someone to participate with um, their local community organizations. And then you want to make sure that the partnerships are two-way beneficial. It shouldn't just be beneficial for the health department, for the health organization or hospital. It shouldn't just be beneficial for the community organization. It should work both ways.
Yeah, great advice. So this last question before we invite everyone back in, I think one of the things we've heard from pretty much every single panelist today is that, a large part of your time is spent addressing misinformation.
Yeah.
So among your patients and your community about COVID-19 generally, and the vaccine generally, but also specifically during pregnancy, that's why we're here talking, about this today. What are you finding, how are you communicating about that, and what are you finding to be helpful?
So the One Network uses, besides, like I said earlier, flooding their timelines, because a lot of our moms um, are young, not they're over 18, but a lot of them are under 40. And so that age group is usually very heavily involved with social media. So we really rely a lot on our social media engagement. We flood their timelines with factual, culturally relevant is the key word today for me, culturally relevant information. We rely heavily on our community health workers, though. They are the secret sauce. Our community health workers already do a deep dive into social determinants of health with all of our women when they present pregnant and they come to us as participants. And so our community health workers have already built that trusting relationship with their moms. They're the source that those patients look to get honest information, that information that they feel like if they don't feel comfortable talking to a provider or a healthcare provider, then they talk to the community health workers because they trust them. That's mom, that's my aunt, that's a big sister. However, the relationship they built, the community health workers really are the secret sauce. And we've ensured that our CHWs are properly trained and they're comfortable sharing this information with moms. Um, and I, as a leader, consistently meet with them to discuss. I just want to hear, what have you heard? What have you seen? What are your patients saying to you? What are your moms saying? And then I take that information and reach out to our physician and disease prevention and control colleagues to fact check, ask questions, figure out, okay, this is what we heard. Where are the facts? Where is it? We often, very often, refer people obviously to the Centers for Disease Control website, to our own Henry Ford website, and just really sit down and have those conversations that are extremely important to try to get these myths, as someone mentioned, these myths debunked.
Yes. So any final words before we invite Dana and Kara back? Sharmila and Ashonda, anything you want to add?
I just want to echo what Courtney said. I think it's so important. And I do believe in these community health workers that are so essential for getting better care for our patients, to get the information, but to connecting them to the clinical care that they may need. We had similar programs when I was working at Alabama that was so effective for cancer screening. And we recently just got a Robin Hood grant that we are creating a whole system of community health workers to address this very issue. And I would love to team up with Henry Ford, because clearly you're ahead of the game. And I think it's so important to listen to our community. And if it's not working, it means that communication has broken down somewhere. Mm-hmm. And so we really have to spend the time to understand, how do we work better with our communities to get them the care that they feel comfortable with?
And I just want to add, again, Courtney, I applaud you. There has to be a recognition of the social determinants of health, because this impacts the community. You need to listen to the communities. You need to work with community-based organizations, faith-based organizations, to make sure you understand the need of the community, and that's how you'll properly be able to address it. And I think that what Courtney said and what community health workers do is they so much are essential for care coordination. And I think that recognition sometimes is not really highlighted. But when they help so many patients, it's certainly needed, and it has to be recognized.
Thank you. Great discussion. We're going to invite Dana and Kara back on stage. Here we go. Okay. And we have about, I think we have about a little less than 10 minutes, but I'm going to ask some questions, and then really just engage in group discussion, I think is better than Q&A at this point. And then we'll have a little bit of time for our audience Q&A at the end. So what about the barriers? Any ideas that you may think of to overcome what we're seeing?
So maybe I can start. I mean, I think everyone touched on, pregnancy is a time when, there's a lot of influencers in people's lives. And I think COVID has made it hard, because now when we see patients, we see them alone. We don't see them with their partner. We don't see them with their mom. We don't see them with their, confidence. So one of the things we have tried to do is to try to take advantage of opportunities to say, hey, let's have a conversation. Let's call whomever, your spouse, your partner, your sister, your mom, and have this conversation with them. And that's been helpful in certain settings. The other thing, and I really applaud, Courtney, your efforts with community health workers, but the other thing that I think is essential, and I've watched it progress over this pandemic, is to bring your whole team on board. So every time I went to clinic yesterday, and every time I go to clinic, I say, all right, everybody, all our CMAs, all our CNMs, everybody that's touching our patient population, what are your questions? Let's go through it. They say, well, what about this 5 days of isolation? Tell me about that, Dr. Meany. Like, why was that decision made? So, that's not directly related to vaccine, but having that open conversation with them so that we are communicating the information because every person that touches that patient while they're there for that visit should have the same information. And they have a lot of questions, and it is evolving and it is changing. They put me on the spot every time I go to clinic and always have great questions and, challenge the decisions that have been made. But I think it started with our group of CMAs and nurses not wanting to be vaccinated themselves. And now they're our strongest advocates for vaccination. So you can make those shifts, and it won't be in one day with one conversation. But I think not only community health workers, but throughout the engagement with patients. And that's why it's important that we're talking here with the American Hospital Association, because if we can really extend that throughout clinics and hospitals, I think we'll make a difference.
So what lessons have you learned during the pandemic? I'm sure we could probably take a whole hour and just talk about that. But is there anything in particular that stands out in your minds?
I would say the lessons that I've learned are patience, empathy, the fragility of life, the random acts of kindness, and thoughtfulness goes a long way. And again, I think one of the things that everyone had talked about was we don't have enough time with our patients. And sometimes we need to take that extra time so that they understand that how much we care about them. And I think, like Dana said, is making sure we huddle with our teams as well to make sure everyone's well-being is okay. Because I think that we learned about burnout during this pandemic. We learned about mental wellness and mental health and the importance of that. And now you kind of throw that into pregnancy in itself, and it's a lot of things at once. So we want to make sure that we are patient with our patients, but also acknowledging that there are mental health needs that need to be addressed as well. And so I think those are the things that I've learned, and just understanding the hardship of the pandemic and how many people have been lost. And we want to be respectful of that and respectful of families, how lifestyles have changed, how children's childhoods have changed, and just making sure that we are a good listener to our patients, but also our team members, that we're all working together and we're all taking care of each other.
Yeah, I think to add to that, I've learned particularly you cannot judge people or make assumptions. Working with pregnant women and women in my own community, I think that it's easy to make assumptions that people know or don't know or feel the same way that I may feel about a particular topic, and it's just not true. So listening, having conversations, listening wholeheartedly, not judging each other, and understanding that our words matter. The language that we use, the verbiage that we choose when having these very important conversations can make the biggest difference between making or breaking the trust that you build with your community and patients.
Anybody else like to add to
You know,
those
I
lessons?
Oh, yeah, sorry. Yeah, no, I agree with everything that's been said. It's been said very beautifully. And, I think that one thing that we learned is that we have to go to where the patients are and where they need our help. And if anything, we've learned from telemedicine, the effects of telemedicine of providing better access for those patients that now, they go from not showing up to clinic to now having the ability to speak to us when they need to with telemedicine. I mean, that opened up other doors of issues as well. But I think keeping along that theme of going to where our patients need us to go and meet them, and being very respectful and with humility. And I think that we need to keep that thought in our heads when we're trying to address any issue going forward.
Wow. Lessons learned during the pandemic, not just for our pregnant people, but really, lessons for life.
Sure.
Really valuable to hear your comments. So I think we're going to cut our discussion a little bit short because we have a lot of questions in the chat. So, and I'm not sure that we're going to get through all of them, but I'm going to read them. And then whoever would like to, to field the question, please feel free to answer. The first question is, do you have a workflow for how you have incorporated vaccine education or asking if patients are vaccinated into each prenatal visit? Anybody have a workflow or what would like to address that?
I can add that our teams have been using, we have Epic as an EMR. And so we have the educational information from ACOG, SMFM, and we've incorporated that into Epic. So it's easy it triggers us into talking about it. And then we are able to document it as well. But that's been very helpful for us as a workflow, and printing it out for the patients if they need it in the language they need.
Yeah, that's great.
In addition, and we're the same. And then in addition to that, in our new OB packages, we have an immense amount of information and literature on COVID vaccination. And we have the literature from ACOG that we dispense to the patients. And we offer it at each visit if needed, if they're not vaccinated. It is something that we discuss at each visit. And again, having the availability to answer questions that the patients may have, but also providing opportunity if they want to be vaccinated to kind of helping them kind of coordinate that vaccination. So I think it just remains an open discussion until a patient is fully vaccinated or boosted during their pregnancy or thereafter or before.
Thank you.
Oh,
anybody want to add? Go ahead, Dana.
Yeah, I was just going to add, if you don't mind. I mean, I think the other piece that may only be appropriate for academic centers, but I can tell you, often it's the medical students and the residents, who go in and start the initial conversation. They may not have the experience yet to be skilled to have these conversations. So I think for us, a big part of what we do is take the opportunity as attending physicians to, bring the issue up again and actually model for our, emerging residents and, medical students how to have the conversation. So, because I think we have to bring along also the junior folks in learning how to have these conversations. And then the other thing that I think is important in this setting is that sometimes vaccine clinics are not in the same place as where you're seeing the prenatal patient, right? So I might be able to say to a patient, okay, we're gonna have this conversation about COVID vaccine. How are you feeling at the end? Oh yes, I wanna go get vaccinated. And then when they come back for their visit, I say, how'd the vaccination go? And they said, well, I didn't make it there because it's one floor down. So sort of taking advantage of opportunities in your workflow to have individuals, accompany them down if they're interested, again, in being accompanied to these clinics, and sort of removing that as a barrier. It seems ridiculous that it's one floor down, but it actually can be a barrier. So I think that's another piece. We should not have any access issues at this point. We need to make it available. And if that means we have to go the extra mile to walk them one flight down, we should do that.
And I think I'm just going to add one more thing, and also having creative solutions. And so, like most places, we're offering the vaccination in our OB triage. So if a patient comes in for a triage visit, they are able to get it there. We are also offering it in our ER settings. And then also, if they're admitted for delivery, we can offer it to them before their discharge. So again, we have to be creative in these solutions because, again, this is a very different time. And so we can't say normalize that this is the only one approach. We can be creative and inventive about how we can increase access for our patients.
If you don't mind, if I can add to that, we do the same thing. And we've also incorporated working very closely with our pediatric colleagues because they're very good at giving vaccines. I mean, they're really good at this. And so we've learned from them, but we're also working with them on creating town halls where we have the ability to show patients that we're working together. We're a unified voice, and we're working with community partners along that way. But I think that we shouldn't forget our esteemed pediatric colleagues that are very good at explaining things and probably have more impact because they're with that patient and the newborn when they're seeing their visits, and that's another opportunity to have the conversation.
So one more question, and I hope we have time to get through maybe two, but I know we have time for one more. And it's probably a Dana question. At least we'll direct it to you first, Dana. But what data do we have on pregnant people that have received the vaccine but get breakthrough COVID? And follow up, what complications can occur for the pregnant person or the baby, and how does the vaccine impact the incidence of any complications? So any emerging data you want to share with us?
So I would say this is an active area that we're studying. I can't quote you off the top of my head what the incidence of, breakthrough COVID is, but what I can say is we're not seeing it at higher rates for pregnant women than we're seeing for the general population, right? Our first step, with anything, with COVID, is this different in pregnancy versus not in pregnancy? So at least at the moment, we're not seeing a higher incidence of breakthrough infections, post-vaccine among pregnant women. And the same thing is true, not yet there in terms of data on complications. We do have at CDC, it actually came out of Zika, a surveillance of emerging threats to moms and babies network, which basically was the Zika infant pregnancy and infant registry that we then converted and used to study other infections, including congenital syphilis, hepatitis C, and now, of course, COVID. And that's where a lot of our data is coming from. I wish I could say that was a super fast system, but it requires that we receive information from clinical providers to our state jurisdictions to CDC. So it takes us some time to get these questions, but get these questions answered. But I'm just excited that we have this surveillance system that hopefully will get us answers to these questions much more quickly than we had in the past, where we had to set up randomized controlled trials and sort of wait for all that to happen. So I don't have the answers quite yet to this, but I will tell you that we're absolutely working on them. I think the other question is, what about variants? Right. So we know Delta had some concerns about it being more severe. We know for the general population, Omicron seems less severe. We still need to look at the variants, which relates to this vaccine question, and how that actually impacts complications in pregnancy. All very much under study. Hopefully we'll get this data out as quickly as we can.
Can I chime in quickly too? I just wanted to say that while it is, as Dana mentioned, an area of investigation, there is emerging data to show that vaccination does reduce the likelihood of severe illness for pregnant people. And there's been emerging data out of Israel and the US and now Scotland to highlight that. So it's very promising that it is effective in these populations.
Thank you. That's great to hear. And I guess we'll just be watching, because there'll be more data coming, forthcoming shortly. A couple questions, and I don't know that we have time to answer them, but perhaps in the follow-up email. It seems like a number of folks are asking about what we can do to combat misinformation on social media, particularly one in particular says, where can low resource providers and hospitals find social media posts, and I'm sure sites that can get them started with countering misinformation on social media? Anybody want to take a 30-second stab at that before we wrap?
CDC has a bunch of resources, so I'm happy to share links after this webinar is over. So anything that we have on the website. And in terms of misinformation, the Surgeon General also has a really great toolkit on addressing misinformation that would also be useful, I think, in this context.
And I may add, ACOG as well has a lot of patient-facing information in a patient-friendly website and literature, and also on their social media platforms. They also have a lot of the scientific information for the patients.
Wonderful.
And we do it personally. I mean, that's the other thing, that us as providers, I mean, every time there's a new study that comes out, I put it all over my Facebook. I'm not on all the other things, but I think as individuals, what can we do as institutions, but what can we also do as individuals? And you'd be surprised how much you can actually do as an individual with social media.
And I was going to say also, the less you engage with those types of posts, the less it may seem like they have legs and they are all over the place, but sometimes it's only a few people that you may know, you see it, and it's not as widespread as you think. So the less you engage with those types of things and even if you send it to somebody and say, this is ridiculous, that's engagement on behalf of that post. And so you want to keep the engagement low on those types of things so it doesn't continue to randomly show up on people's feeds and searches and all those.
Okay, so I think we're right at the top of the hour. I'm going to, say we're a wrap. Thank you so much, Dana, Kara, Ashonda, Sharmila, and Courtney for joining us and sharing your expertise and insights. And thank you to all of you who joined our virtual event today. Allow me to also extend my thanks to the AHA's Living Learning Network for their help in convening today's panel and deepening this conversation on their platform. The LLN, now in its second year, is a CDC-funded peer-to-peer community of healthcare professionals dedicated to helping hospitals and health systems recover, rebuild, and reimagine the future of healthcare. We will be sharing a follow-up email after this event with information on how you can join the LLN to connect with your peers and continue to discuss and share strategies on how to support pregnant women in getting the COVID-19 vaccinations. A replay of this virtual event will be posted to the AHA website in the next few days. Find the archive and all of AHA's vaccine confidence resources at aha.org/vaccine confidence. Thank you again for joining us and have a wonderful day. Thank you all.
Thank you. Bye-bye. Thank you.
Bye-bye.